Over the past few months, we have experienced an unprecedented shift in our way of life due to COVID-19. One thing that is certain, we know that adjusting to change can be challenging, be it planned, unplanned, gradual, or sudden. Change is inevitable and very much part of being human. For any disease, pandemic, or epidemic, there's something called illness wellness continuum. It's a graphical illustration of a well-being concept first proposed by Travis in 1972. What does this mean? That means if you really want to achieve high level of wellness for any disease, whether this is epidemic, pandemic, or any chronic disease like diabetes, hypertension, or dyslipidemia, the most important part is awareness, education, then only you will be able to achieve high level of wellness. So that means proper education, right guidance by right people at the right time, you can really have the optimal health. If you don't want to listen to that part, then it gradually develops into symptoms, dysfunction, poor health, and disease. So that's why we at Prime try to bring a lot of webinars, health sessions, and diabetes occupy nearly 40% of the healthcare industry is very crucial for us. So I also take an opportunity through this webinar to get back to you that what actually we should know about diabetes. People who are affected with diabetes are certainly they must be knowing much better than me how to take care and what to do and what are the complications. But we are also keen in educating people. We are also keen in telling people that there is a huge group which are going towards the diabetes. Specifically in this pandemic, we have seen a huge surge of a huge rise of people, young people getting into diabetes because they don't get to their physicians on the right time. So I just want to give you a brief history so that you know that it's not only COVID we should be worried about, it's also the diabetes what we should be worried about. For your information, diabetes was first identified as early as 1500 BC, and now today in 2020, I'm trying to correlate that in 1500 BC, the first kind of identified kind of diagnosis of diabetes. During the Middle Ages, doctors used uroscopy, a practice where they studied urine to diagnose a medical condition. We are definitely equipped with a lot of information and a lot of things, but still it looks like history of diabetes is being still written. And as Mr. Fahad correctly mentioned that Mr. Frederick Banting, Charles Best, and John MacLeod, they discovered the insulin. That's why we want to celebrate this World Diabetes Day on 14th of every month. Reason being that we could see the large number of concerns growing all over the world, and this escalating health issues which was caused by diabetes. Rather, I will say it was a threat posed by diabetes. So that's why in order to make it like breast cancer awareness, they made it like also diabetes awareness month. So but the history still started from 1500, and we are now in 2020. We should know that over a period of time we have learned a lot. Out of that learning, we want to give you that, we want to empower you with that knowledge, and we don't want people to get affected. Why we are so sure that where we are, I want you to have a quick look on the diabetes, a global view. As per International Diabetes Federation, 463 million adults worldwide are diagnosed with diabetes. That's why this year we have also made it a kind of logo or a kind of awareness for all of our people at Prime that this is not a concern for me, you, this is the whole world concern. The world should not be concerned about only COVID. The world should be concerned about the other chronic diseases, and we should definitely look into that. People who are affected with diabetes, you will hear a lot of time I'll repeat the same thing, that there's something called people who don't know that they have diabetes, and people who are already affected with diabetes. So the crucial part over the diabetes is that people with diabetes who don't know they have it is nearly 50% of the total population. Since we can't test every person. We don't know the exact numbers, but roughly if it is 100 population, 50 might be having, a strong prevalence or strong history getting into diabetes. Not only that, 3 people every 10 seconds develops diabetes. The number of patients with diabetes worldwide is expected to increase from 382 million, which was in 2013, to 592 million in 2035. We don't want our people to be a contribution to this number. That's why attending to these sessions, attending to these webinars, and most importantly, listening to your doctors is very crucial. Though sometimes we really get bored. Okay, it's the same topic: control diabetes, do this, do that. But we want to say it repeatedly so that you understand that it's a huge number progressing in 382 to 592 million. And wherein I'm correlating always with the COVID, because COVID has really put an impact where we could understand that awareness is important and prevention is important. So why not with something which is already no less than a pandemic? And as a result of diabetes causes an increased risk of other diseases such as blindness, heart attack, kidney failure, strokes, dental problems, amputations, pregnancy complications, nerve damage, sexual dysfunctions. Yes, this is one of the very important part. Maybe most of the people don't know, but a lot of issues with men can happen and women can happen because of the diabetes, and of course the insulin injection. So awareness on this part is equally crucial. If we talk about these diseases, we must talk about the numbers as well. One person every 6 seconds. Heart disease is 2 to 4-fold on rise. Stroke is more than 2 to 4-fold, and blindness, kidney diseases, and dialysis, and other things. But then we are saying that what should we do? Numbers are really scary. Diseases are endless. Is there any remedy? Is there anything what we can do? That's why equipping yourself with the right information about diabetes is important, so that you can preserve your and your family's health. So now coming to the main topic, what is diabetes? I would like to clear here that diabetes is a huge topic, which definitely, even if we give consequently 3 days, we'll not be able to finish. But in less time, how much I will be able to give to you should be the most important information. So diabetes is a condition in which the amount of glucose or sugar in the blood is too high because the body cannot use it properly. Now, what is the science behind this? Diabetes and your pancreas. So a direct connection exists between the pancreas, which is pancreas and diabetes. The pancreas is an organ deep in your abdomen behind your stomach. It is an important part of your digestive system. The pancreas produces enzymes and hormones that help you digest food. And one of the hormones, insulin, is necessary to regulate glucose. So when we eat food, food is converted into glucose. As blood sugar level rises, the pancreas makes insulin. Blood carries glucose and insulin to every cell in the body. Glucose refers to sugar in your body. So every cell in our body needs glucose for energy. If there is no glucose, there's no energy, definitely. So what happens is, think of insulin as a lock to the cell. No insulin, cells do not absorb glucose, no energy. A second condition, insulin is present, but either it's not able to produce its function or it is somehow trapped. We call it insulin resistance. So insulin must open the cell to allow it to use glucose for energy. If pancreas doesn't make enough insulin or doesn't make enough insulin or doesn't make good use of it, glucose bind up in our bloodstreams, leaving our cells starved for energy. So what happens? The main symptoms, people who are already diagnosed, they must be knowing, but there are huge numbers who don't know. So if anybody gets affected, like have symptoms like unexplained weight loss, I'm losing weight, I am having extreme tiredness, though I'm not fat. So diabetes definitely happens more in obese people, but that should not be the criteria to exclude from people who are thin. So extreme tiredness, extreme hunger, you're eating, but still the hunger is too much because you need ketosis are happening, a lot of energy is required, extreme thirst, you are drinking enough, but at the same time frequent urination is also there, and a wound which is not healing beyond 2-3 weeks can be also one of the signs of diabetes. And over the period of time you are definitely seeing that the number of the glasses are increasing, and it's because your eyes are also getting affected, and tingling and numbness in hands and feet, though it will not happen suddenly, but if your sugar levels are high for a very long time and you have not checked it, this can be one of the symptoms. So any of these symptoms, if it is there, it can lead to you should go and see the doctor. Now, diabetes overall is classified into many types, but the most important thing is, how we define different type of diabetes is quickly. Type 1 diabetes, where body does not produce insulin and you are insulin dependent. So like if a person doesn't have eye, we'll replace it with eye. If a person doesn't have kidney, we'll replace it with kidney. And if a person is not able to produce insulin, we'll replace it with insulin. So hence insulin is the only treatment, but generally it is most prevalent in the children age group because their pancreas is not functioning as per the requirement. Then type 2 diabetes are mostly the worldwide, where insulin is present, but is present either in less amount or is not able to function as per the requirement of the body. Gestational diabetes happens during the pregnancy. During the pregnancy, a lot of changes happen in the body. So this is one kind of diabetes there. Then there are other which are autoimmune. Then there are the fifth one is the pre-diabetes, something which is crucial and important to know. Now, mostly I will talk on the diabetes type 1 and type 2. Here type 2 is more crucial because it has, as this develops over time, Center for Disease, that means CDC and Prevention, declared in 2020, this year, that it comprises of 90 to 95% of diabetes cases. And usually people 40 years and old are more affected. So we must talk about type 2 diabetes, which is occupying 90% of the total cases of the diabetes. But here now it's a game. You need to understand that diabetes doesn't happen overnight. Suddenly we will get up and a person thinks that, okay, I'm a diabetic today. Like when we are born, there is a stages, then we are children, then we are adults, then we are old age. So diabetes is definitely a disease which requires a lot of patience, lot of attention, and lot of lifestyle management. But this also has one thing, that it doesn't happen overnight unless there is a certain issue with the pancreas, infection with the pancreas, or any other thing. So it gives you a lot of time. This disease is very different from its other diseases. The symptoms are trickier to spot because they appear gradually, sometimes over the space of years. It is also more complex because it involves several functions in the body occurring at the same time across different parts. The problem is that they take much longer to manifest, where there are cases of some people not showing up symptoms at all. So what I mean to say is that to reach to this level, it is not necessary that every time a person is symptomatic, like I previously said. The symptoms will develop when you have already very high blood sugar and you're already a diabetic case. But pre-diabetes, there are very less symptoms, which is a different topic altogether. But yes, if you have things like if anybody who whose parents are diabetic, grandparents are diabetic, everybody is advised to self-assess themselves. One of the major reason, if parents or grandparents have diabetes or high blood pressure, or for that matter dyslipidemia, or we say lipids, high lipids, we must go for the checkup. 40% increased risk if a first degree relative has a type 2 diabetes. That means your siblings and your parents. Then obesity. If somebody is obese, obese means BMI is very high. I believe my colleague is going to cover the nutrition and lifestyle part. Over 85% of people with type 2 diabetes are overweight and obese. We have seen, yes, they are coming to our clinics, and we have the reason to blame obesity for this. Lack of exercise, it can increase the risk to 50%. Older age, the risk is 1 in 20 for those over the age 30 and 1 in 5 over the age of 60. Large waist circumference. Apparently, if any men should be less than 102 centimeters waist size, and women should less than 88 centimeters. Poor diet, high calories from all sources can lead to weight gain and increase the risk. Smoking. Smoking is very, 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 very crucial. It increases the risk up to 60%. I would like to show you the quick glimpse of the cigarette smoking. I'm sure if people who are smoking, they don't need any other risk factor. But, to know that why, doctor, I am getting into diabetes, why I have diabetes, why I don't have controlled diabetes. If I have to give the weightage to all these factors, smoking itself is the biggest risk factor, and you must know that what smoking contains. It's a long list, but I will just quickly read out few for you. This is used in insecticides, that is DDT, used in road material, and not only that, this smoking changes your genes, changes your DNA. So that means parents who are already diabetic, and when they have their children's, they are already giving them a gift of diabetes through genetics. So be very careful about that. And another thing, if quickly I want to tell my audience, if you're diabetic, but let people around you know that there's something called self-assessment again. So I'm going to share this form with you post webinar, but you can also click a picture here, and we are doing a quick pre-diabetes risk assessment score test. How old are you? Whether you are a male, female, if you're a woman, have ever been diagnosed with diabetes during pregnancy? Do you have a mother, father, sister, brother affected with diabetes? Have you ever been diagnosed with high blood pressure? Are you physically active? For how many days? What is your current weight? And we have also kept a table here which can score up. You need to calculate your risk score by adding the points, and if you score 5 or higher, you are likely to have pre-diabetes or are at risk of developing type 2 diabetes. What should you do next? The best thing to do is to meet your primary physician to see if any testing is required. And definitely this goes with a lot of people who have high BMI. So we are going to send it to you post webinar, expecting you to fill and expecting we to guide you, and not to be the numbers for 2035. Generally, whenever a person is diagnosed with diabetes, we have a couple of blood tests to done. If doctor does the examination, does the routine blood test, maybe urine test also, that gives us an complete overview that a person is into pre-diabetes or diabetes range. And also post-diabetes, we have to do the regular follow-ups. That includes fasting glucose, HbA1c levels, random or oral glucose tolerance test, that is to diagnose diabetes, which is not something very difficult for any human being existing now on this earth. Anybody should go and get it done voluntarily. Don't wait for signs and symptoms, and get it checked. Secondly, if for both the things, again, pre-diabetes, risk of diabetes, or symptoms of diabetes, and you want to check, it's a very easy thing that you can buy one glucometer and manage it on routine levels. You can click the picture of the screen. It's very informative for you to know that fasting blood sugar, which means 6 hours of fasting, should have at least normal means 70 to 100, and risk of diabetes is 100 to 125. Now this is most crucial. This is a pre-diabetes stage. If you are into this thing, definitely you should go to the doctor to meet. You should include the dietitian in the part, and get your other systems also checked. Then if your sugar level is more than 126, you are a case of diabetes. Then there's something called 2 hours postprandial blood sugar, which means once you took the food, After 2 hours, for 2 hours, you don't have to eat anything, and you can repeat the blood test. If the level is more than 140 for those who are younger than 50, and for those aged 50 to 60, it's 150. For those older than 60 years, it's 160. Again, random blood sugar, that it doesn't, you don't need to be fasting, you don't need to be waiting for, post food. You can just pick up the glucometer and do the test. If the test before meals or after waking up is showing something between 80 to 120, and more than, it's basically more than 180, you should definitely meet the doctor. Now, again, my very important topic, the diabetes prevention tips. Eat healthy. Now, you need to understand what is healthy. That I'm sure that my colleague is going to cover most of the topic about it. Stay active. How much staying active is important for diabetes? What are the risk factors? I have already explained. What is the normal rate we should look for? We should avoid tobacco and limit alcohol, and we should go for regular checkup for our early diagnosis, and take prescribed medicines regularly if it is advised by the doctor. And if a person is diabetic, what they should do. It is our goal. I always remember that Dr. Kumar always keep on saying that it's about, your goal is to prevent complication through normalizing blood glucose levels. So if a person is diabetic already, it's a diabetes care plan. It involves a lot of discipline. Educate yourself, keep it in check, control diabetes, healthy diet, routine workout, regular foot care, medicines on time, prevent hypoglycemia, and regular checkup as advised by your doctor. So take-home message will be regular screening, appropriate weight loss, exercise, which can be prevented. Type 2 diabetes is the commonest type of diabetes. Mindful diet and regular exercise is the cornerstone to slow the progression of disease. Regular checkup and follow-up. See specialist early. So if people who are going for regular checkups with their primary physician as GPs, and or internal medicine for that matter as well, but your sugar is not getting control, your diabetes is out of control, after a certain period of maybe 6 months or 1 year, if it is still not getting control, endocrinologist should be definitely involved. And you can directly go to endocrinologist as well, but most of the people prefer to go to GPs due to a lot of XYZ reasons. But if it is not getting control, then he is the specialized doctor who knows more than anyone. And it's a group treatment. It's a nutritional approach, it's a lifestyle approach, and it is his specialties as well. So control diabetes from the beginning to prevent complication. Family plays a crucial role, that what to cook today and how we can help each other bringing control to diabetes or preventing diabetes. BP and cholesterol control is crucial to prevent diabetes. And this is very, very important slide for me to tell you. Know yourself whether you are trending pre-diabetes or diabetes, and prevention is surely better than cure. So let's work together towards prevention. I hope I have justified my time and could give you little information on this diabetes overall.